Hey everyone, Dr. Kevin here over at HealthFit today, and I just want to talk a little bit about your physical therapy duration, because we get a lot of questions from our clients asking us, well, how long am I supposed to do physical therapy for? When they say they start to feel better, they're asking, well, why is it that I need to keep coming after I start to feel better? Well, obviously the goal is not to have you here forever, because we don't actually want you to be dependent on physical therapy to keep you feeling good. So it's not this 2 to 3 times a week for 6 months. That's not ideal at all. But at the same time, when you start feeling better, maybe after your second or third session, that's also not the time that you want to stop, because you've only sort of scratched the surface in terms of bringing your symptoms down. We want to be able to have prolonged, sustained well-being. And so in order to do that, one of the ways that we look at how you are feeling is based on our HealthFit system, which is to assess, to alleviate, to correct, and then to prevent. We start with the assessment. So that stage is to get a really good idea of what's going on with your issues, what are some of the underlying issues for why you may feel the way that you do, and then we want to alleviate those symptoms. Whether it's soft tissue mobilization, whether it's exercise, a combination of those, that's what we want to be able to provide you in order to help alleviate your discomfort. Then the correcting part, which is trying to correct the underlying issue, which is found in the assessment. Trying to understand why maybe you have knee pain or why you have back pain. Is it because you're not using your hips enough? Is it because you're staying stationary for too long? Some of these things we need to address by having a conversation, not just in seeing how you move, which is obviously very important, but also hearing a little bit about your lifestyle, what it is that you do. What are some of the things that contribute to your stressors? Because all those things help us to get a better picture of who you are and how to best cater a program that works for you. And then at the end of it all, the prevention part. After we've been able to kind of look at all these different pieces, we want to address that underlying issue, correct it, and then allow you to not have that discomfort moving forward. And in order to do that, there is a duration of trying to reinforce what it is the program is about. What are some of the exercises? What are some of the stretches? What are some of the manual techniques that will help you get to a place where you're not feeling discomfort and keep that ongoing for once you're done with physical therapy as well. Just because you're feeling better, that's not the time that you want to step away from it. You want to continue to strengthen yourself and get you in a place where you're not going to have this issue arise in the future. So if you're curious about what it looks like to kind of have your pain assessed or to have your issues looked at, feel free to give us a call or reach out to us, and we'd love to hear from you. Have a great day.